welcome to the Headache Doctor podcast. This is episode number 1, where I am going to tell you why headaches matter. Encompassing that is my story, how I got started, and why I started Novera Headache Center. My name is Dr. Jono Taves. I'm the founder of Novera Headache Center, and I started Novera, and now I'm starting this podcast because it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and to thrive in everything they do. So if that is you, if you suffer with headaches and migraines, if you know someone, a loved one, a friend, a family member that suffers with headaches and migraines, it's my mission to help empower you or your loved one so that you don't feel helpless, that you don't feel constrained to the constant need to take medication, that you don't feel fearful of missing out on activities with your kids, on social life, on being a mom or a dad, on being a good employee or employer in the workplace, that headaches or migraines don't take over your life. This podcast is primarily focused on providing you with the education and the material that you need to feel empowered. Now, this is an aspect of care that I think is incredibly important. When patients go into a neurology office, to a primary care doctor, to any sort of specialty, one thing in our healthcare system that seems to be missing is the lack of care or time to care appropriately, in the sense that people don't feel listened to. So the education component after a patient feels listened to is lacking. And so what it feels like is patients go into the doctor's office and they get a prescription, or they feel like, oh, I'm just going to receive another medication. I'm just going to receive the next course of care that everyone gets. And so it's my job or my mission to allow you to feel empowered, allow you to feel less fearful of your next headache or migraine day. And this podcast is a great way to start by educating you. So episode number 1 is why migraines matter, why headaches matter. So I will start off with talking about my story. It starts in Rochester, Minnesota at the Mayo Clinic. That's where I graduated with my doctorate in physical therapy. It's a wonderful institution. It's called the WFMC, the world famous Mayo Clinic. There are patients from all around the world that go seek care at the Mayo Clinic. Now, one thing that I did not receive at the Mayo Clinic was a robust understanding of headaches or migraines. So at the Mayo Clinic, they would still take a pharmaceutical approach to headaches and migraines. That's the primary approach that a patient at the Mayo Clinic would receive. Now, as a physical therapist, our education is focused on the musculoskeletal system. So our skeletal structure and the muscles, tendons, ligaments that act on that skeletal system to allow us to move. As a physical therapist, we are trained to know how to restore mobility to that musculoskeletal system so that our body doesn't respond in a way that's dysfunctional, leading to pain. And so physical therapists throughout the world, no matter what setting, can typically be simplified in their work, and what they do is that we restore movement. We resolve dysfunction, which results in reduced pain. Now, in the outpatient setting, that's our focus. We're reducing pain levels. And so at the Mayo Clinic, it was a foundation building experience of what does the musculoskeletal system need in order to reduce pain, resolve pain. A patient comes in with low back pain, a patient comes in with knee pain, a patient is a runner and has pain at mile 3, 4, 5. How do you improve their body's function so that there's less stress placed through the joints, tendons, ligaments, and those tissues are not irritated? How do you preserve function at the end of life? How do you preserve function so that quality of life can improve? That's anything from a patient that suffers from a traumatic brain injury to someone that is an athlete that's 14 or 15 and just wants to play volleyball. And so restoring function has lots of applications and lots of benefits to you, the patient, especially when it comes to pain and resolving pain. So at the Mayo Clinic, I got this very, very good foundation of what it means to work with the musculoskeletal system and restore function. There were a few pivotal things that happened during my time at the Mayo Clinic. One was we had an interaction with fourth year medical students. So they were, I believe, a month or two away from graduating with their MD degree. They would go on to a residency program. We, as PT students in our second year of physical therapy school, so primarily had just been didactic in the classroom, we met with them and went over musculoskeletal cases. So these were patients that had shoulder pain, low back pain, knee pain, and we would receive a case, basically just a short story of the patient telling a provider their symptoms, and then we would discuss how we would approach that case. Now, it was eye-opening to me to understand just how limited the MD education was in understanding the musculoskeletal system. And the other thing too is how heavily that type of provider would rely on imaging and then pharmaceuticals as far as their treatment and intervention. Now, everything that we learn as physical therapists and what the research is showing is that there's a push to conservative treatments. You think about the opioid epidemic that's happening, and what is coming to the forefront are conservative interventions, such as physical therapy. My education at the Mayo Clinic provided me with this insight to understand, okay, part of the problem is, as a physical therapist, I should have confidence when treating a musculoskeletal problem, and the medical doctor has his role, but if we are taking a conservative approach and evaluating a musculoskeletal problem, a physical therapist is the appropriate provider, because a physical therapist will have the best perspective with the training that they received compared to a medical doctor. So that was my first kind of light bulb moment, is as a physical therapist, we have a lot of value when it comes to the healthcare system. The second was I had an interaction with a guru, a physical therapist in Minnesota that was excellent, and he would teach in different settings around the state, and I had the opportunity to learn about the upper cervical spine, the upper part of the neck, and how that relates to headaches and migraines and neck pain and dysfunction in the neck. So talking about the musculoskeletal system, which I knew well, and how that relates to the neck, and how the neck presents with pain that can refer to the head or the face. So I had this understanding of headaches and how they relate to the neck and how to treat those coming out of the Mayo Clinic. The first couple of years after graduation, I started to treat headache and migraine patients. Now, those patients are, what I started to learn was they suffered in a way that they were not given hope in too many settings. There were not many outlets within our Western medicine model that provided them with, hey, here's a solution, here's something that will do it, it'll get to the source of the problem, and there's a really good chance it'll provide relief. So everything from just over-the-counter meds to the opioids to the preventatives and abortives and eventually maybe Botox, any of these interventions was really just providing symptomatic relief. So it wasn't providing an answer to the underlying source of pain, and it was really diminishing or reducing the intensity or frequency of their symptoms, but these patients did not have an answer as to why this was happening. I started to treat these patients. Many of them got better, and especially right out of school, what I learned was that the migraine patient, typically within the physical therapy world, the migraine patient is typically referred to the neurologist, and it's almost like this thing that you don't want to deal with. The migraine is out of our scope, it's out of our realm. It's something that is so confusing and so debilitating that as a physical therapist, we actually can't do anything about that. Patient just needs medication, and they're just going to deal with that. Well, what happened was these headache patients, when their headache was bad enough, it would be a migraine. So these patients would have a migraine a week, a couple migraines a week. It was debilitating. And I would work on them as if they, had this dysfunction in their head and neck, in the upper part of their neck, and they would improve. And it was this aha moment of, this is bigger than just the tension type headaches that providers were sending to us. And what it launched me into was this self-discovery of, what does the research say? What are the studies? What are the journal articles out there that we need to look into that kind of give proof of there's something here that needs to be addressed? And I found that the neurologists, the experts when it comes to migraines, didn't have a very good answer for the patient. And a lot of it was this guessing game of, let's trial medication after medication to see which one works. And the neurologist was really just much better equipped at knowing what the side effects of the medications were and how to handle the stronger medications. They didn't necessarily have this great insight into what is actually causing the pain. So as a physical therapist, I'm asking myself, okay, I am trained within the musculoskeletal system to be able to treat any sort of dysfunction effectively. That's my role as a physical therapist within the healthcare realm, is to treat musculoskeletal dysfunction. Now, if the upper cervical spine, if the upper part of the neck is a key player when it comes to headaches and migraine symptoms, then I need to be the one that steps into this space. Now, to take a few steps back, physical therapists, I would venture to say 95% of physical therapists do not feel comfortable treating the neck when it comes to headaches and migraines. Now, good manual therapists, good therapists that work with their hands, will see neck patients and do a good job with treating the neck. When it comes to headaches, I see therapists that do a good job treating headaches. Migraines is that category that therapists start to get uncomfortable. Therapists, good clinicians, are more comfortable treating back pain, knee pain. They're helping runners, they're helping athletes, and there is this sort of push towards the low back, towards other sorts of athletic settings that most of these good therapists are going into. And there's this lack or this void of care for the headache and migraine patient within my own profession. So seeing this void, seeing this gap, and then seeing that the dysfunction in the neck can lead to these headaches and migraines caused me to start putting videos on Facebook. And so I created a Facebook page called The Headache Doctor, and I started to get patients that had headaches and migraines. And one patient in particular had an impact on me that kind of launched me into starting Novera. Now, this was a woman, and she was married, she had kids, she had a small group that was praying for her because of how debilitating her migraines were, and she had dealt with these for decades. And my wife met her at a party and said it. My wife said, "Hey, my husband treats migraines, you should try him out." And she was at her wit's end. She had not found relief, substantial relief from anything to that point, and she thought, this is it, I just have to live like this. And so she actually, took a chance and came to see me, and within a month, 2 months, I was able to help her get to the point where if she was having 2 to 3 migraines a week, she was down to maybe a mild headache a week, and within a month's period, she might have a migraine, but it was less severe than before she started to see me. And so this was the most impactful treatment approach that she had seen yet. And all I was doing was restoring function, movement to the upper part of the neck. And so this was, again, another light bulb moment where, man, this is a patient that's debilitated. Half of migraine sufferers are bedridden when they have this severe pain, that's a severely disabled individual. This is a huge problem. This is something that costs not only employers, but the healthcare system millions, if not billions of dollars every year because of the lost time at work, but then the expenses that the patient will accrue because of their constant neurology visits, medications, imaging. So this is a big deal, and this is something that this patient had seen neurologists, she had been to pain management, she had seen several primary care providers, and no one was able to help her to this extent. And so what happened was I got to the point where I said, okay, I need to create a clinic, a setting that's specifically catered to this type of patient. And it took me a year plus to kind of think this up, draw out the business plan, and then launch what is now Novera Headache Center. But this is what I imagine every headache and migraine patient needing, not 10, 20, 30 years after they've tried everything, but I want the patient who just started having migraines or headaches, and we need to cut that off and save you from 10, 20, 30 years of debilitating head and neck pain that is going to place you in bed for so many days of your life. And so it's this idea of why do people need to miss out on so many activities in life, whether that's, I've had patients in the clinic that have been waiting for their wedding day, preparing for their wedding day, and just they're fearful that they're going to have a migraine on their wedding day. They're fearful that their kid's big event is going to be missed because they wake up and there it is, another migraine that keeps them in bed. How many moms, so women are 2 to 3 times more likely to suffer with migraines. How many mothers out there are just having to tell their kid, sorry, mommy can't play right now? And it's this hopelessness of let's just trial medication after medication and let's keep the abortive in my pocket so that within the first 2 hours of getting something, it'll dull the symptoms. Now, medication has its place in the neurologist and the MDs in the healthcare system, but the most conservative approach, the underlying source of pain, there can be an answer for many, many patients that are struggling with headaches and migraines. And so it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and to thrive in everything you do. Now, the reason I'm on that mission is because I know for many of you there's an underlying source of pain that can be treated effectively, and you don't have to live this life dependent on medication and fearful of your next headache or migraine day. So again, I will reiterate, Novera Headache Center, located right here in Colorado Springs. I started this specifically for you or your loved one who suffers with headaches and migraines and is tired of searching for a solution and just wants something that can provide them with a treatment that gets at the source and will last, will be something that will provide them with an answer so that you can have your life back. You don't have to be fearful of losing days to migraines or headaches. And then this podcast is a weekly podcast to provide you with information that will also empower you, that will give you tools, that will equip you with the understanding that should allow you to direct yourself or your plan of care throughout the healthcare system in a more effective way. So if you're living out of state, if you're across the country, I've had patients actually fly in from Europe for treatment. So if you are listening to this and you can't book an appointment at Novera next week or the week after, then stay tuned. And even if you are a current patient or if you have seen me, stay tuned and tell anyone with a headache or a migraine that this is an option. Now, my one asterisk or my one word of advice to you is the biggest barrier I have communicating this with people that have headaches or migraines is that their gut reaction will be to explain that they and their symptoms are different, that they will not fit, that they are not the type of patient that can just get better with a neck sort of treatment by going to see a physical therapist. Now, a few thoughts on that. I have seen nearly every type of headache and migraine, and even the most severe migraines, even the people that have the debilitating pain several times a week that have thought there's no hope, those patients have found profound improvements. They've gone from several migraines a week to nothing for months. It's incredible. And the reason is because this underlying solution is overlooked. The other thing that people will say is, my headaches or migraines are related to pressure changes. My migraines are related to hormones. Mine are triggered by this or that. Like, how can physical therapists help me? Is the neck actually involved? I don't actually have neck pain. Now, it's so nuanced, and there are so many great answers to those questions that I will answer on this podcast. So I want you to stay tuned. But just trust that there can still be hope for. It doesn't matter the type of headache or migraine out there. If you have chronically suffered with headaches and migraines, or if you're at the end of your rope, if you have tried medication after medication, I would encourage you to stay tuned and call us at Novera Headache Center, and we would be happy to hear your story. If nothing else, we'll point you in the right direction, but there's a very, very good chance that there can be some hope for you. So I would put a plug in for Novera Headache Center. Visit our website, www.noveraheadachecenter.com, and be sure to subscribe to this podcast. Tune in weekly, and I hope you find it helpful, and thanks for listening.